we go live yet? Ooh, come on, buddy. Well, I guess we are live. I didn't get a count in, so I guess I am live with you guys. I didn't get a count in. Hey guys, man, there's a lot going on. As you can see, my office is in kind of shambles right now. So, other than that, I mean, we got things going on. Most of you that do know that I'm in the middle of trying to get a show done for this weekend. So I'm not my normal self. We're a little bit behind on the show. We were doing some sound checks with the call in line. So I know some of you are really excited about that. We are still trying to get the call in line sorted. So bear with me as I'm popping plugs and doing stuff. And I'm driving Heather crazy because I keep calling her on the phone and trying to get things to work. So please do bear with me as I try to get that all sorted out and worked out. But some really cool things coming on the show today. We're going to be talking about the importance of peer support. So hopefully you guys will enjoy this show and it'll be a good thing for you guys. As you can tell, I have a new light. Man, this light is so bright. It just lit up the whole room and now look orange. So bear with me on that. And as we get some of these new things kind of settled, my office is a mess. So please bear with me on that. And you're going to have to get used to me looking up. So now I can kind of see your guys' comments and I can respond to you guys. So I can say to you guys, welcome. Now, keep in mind when I'm talking on the show and I'm doing what I'm doing as far as reading my notes, I'm not looking up as much as I should be, but if I see something and I can respond to it, I will. So just bear with me as I learn this whole new setup and try and make the show a little bit more interactive for you guys so that you can do call-ins and you can chat with me and you can talk to me and ask me questions as we kind of go through some of the stuff that I talk about daily on a show. So hopefully everybody can hear the volume good and everything's good. I'm sitting a little bit farther back from the mic so you don't hear me breathing as heavy and you don't get to hear my smacking. So with that being said, I got to get the show started. So just bear with me as I do some of my house cleaning to get the show started and getting used to this mouse going back and forth between two screens up and down, driving me nuts. But we're going to work our way through it and we're going to figure this out. So welcome everybody to another episode of Amp Life Talk Radio on Facebook. Let's get through this episode and hopefully you guys will enjoy what the topic's about tonight. Feel free to give me some of your input in the comments and I will definitely try to get to those. Okay. Thank you, everyone. I will be right back. Just give me a second to get the show queued up.
You are listening to Sean Harrison on Amp Life Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.
And I'd like to welcome everybody back to another show. I kind of talked to the people on Facebook a little bit earlier before I actually came live on with you guys. There's a lot going on, man. We're trying to get some of these things settled in the little studio here so that we can do live phone calls. I just remembered on Facebook, you're not going to be hearing some of the intro music and stuff, which we're not going to be doing a lot of that, just because I didn't click a little box in there that lets you hear all my stuff through my mixer. So bear with me. Maybe I'll turn up the volume and let you guys kind of hear some of the stuff that I get to hear. And maybe you'll hear some of that music and you'll hear me in the background. But I got to keep it a little bit low because if I don't, we're going to get a little feedback situation, as you can kind of hear there. So I'll try and play some of that through the speaker so you can kind of hear on the breaks what everybody else is hearing out there in live podcast radio land. So, hey, welcome back to another episode of Amp Life Talk Radio. I got to say a big thank you to all the people that have been showing me love on Facebook, all the people that have been sharing the show and doing all the different things as far as putting the word out there for me. I really appreciate that. I'm so thankful. And let me tell you, I got coffee mugs sitting behind me. Man, I thought I would get away with getting like 10 or 15 of these things. And apparently, you guys really want some coffee mugs. So I got to find somebody that can print these things and make them by the hundreds because we've got so many people that are interested in a coffee mug. So bear with me on that. I will get those. In fact, I was going to have some coffee, but it's a little hot here in Modesto. Um, as you can see, a good friend of mine, Mike, he got one and he took a picture with it. That's all I asked. If you get a mug, shoot a good picture of it and send it over to us and we'll post you on the site. Now, tonight, I want to thank everybody for tuning in again. You are listening to Amp Life Talk Radio. I'd like to welcome everybody back. Those of you that are new, those of you that are old, that have been here before. I want to welcome you and say thank you to listening to Amp Life Talk Radio, a talk show about amputees and limb loss. We try our best to empower amputees and those affected by limb loss to go out and to live a full life. We try to give you knowledge, support, and information. Also, we try to work with the family members of those that are affected by limb loss. We want you to be able to tune into the show and also get something from this show. Now, most of you can see we're at season 2, episode 27. The importance of peer support. And one of the reasons I kind of got into this show, as most of you kind of know, I post different things on Facebook and talk about the importance of peer support. And one of the things I'm going to be doing is I'm going to be pulling up, hopefully I can break away with all these screens I have and look at some of your comments that you posted on the little question that I left about peer support. Really important aspect of amputation is peer support. Unfortunately, a lot of people don't think it is in the medical and health profession. The importance of peer support, given the totality of the published evidence that's out there, albeit limited, in favor of amputee peer support, there is an abundance of unpublished anecdotal evidence, articles, journals, and they're out there. And there are support groups. There are people out there who do this. And one of those are this show. That's one of the reasons I came up with this show, is to try and help you be able to have someone that you can come to, talk with, listen to, hear different topics, learn something. And eventually we're going to have this be a very interactive experience for all of you that listen to the show, whether it's through chatting or whether it's through calling into the show. I want to make sure that you all have an opportunity to be a part of the show, because without you, there is no show. That is the biggest thing. Now, one of the things I really want to make sure I put out there before we even start the show, peer support, peer visiting. This is so important, but we want to make sure that this is always performed by a certified individual. There are virtually no risk involved, really, when you're dealing with someone who actually knows what they're doing. It's low cost most of the time. Amputee Coalition of America, most of their visits, and most of the ones I do for Amputee Coalition of America, it's free. So, and I've met several people over the last few weeks that I've been talking with. Hey, Zach, I'll be in touch with you, buddy. So it seems so reasonable to recommend this type of service to be incorporated into the preoperative and postoperative amputee peer visiting support protocols in hospitals, rehabilitation centers, and with orthopedic surgeons, especially when we're talking about incurring a major limb amputation. Very crucial. The services, what peer support does, what amputee peer counselors do. So crucial. Now, there is an abundance of medical research regarding the preoperative and postoperative physical rehabilitation of amputees and comparatively sparse amounts of psychological aspects of the healing process. So it's out there. The information is that this works and how it needs to be more incorporated into the care aspect of amputees. Now, unfortunately, the unmet need to address health and the mental health of recent amputees, new amputees, has definitely been identified in some of the literature that I looked at to get the resources and research that I did for this show. That literature um, is out there. Um, all you have to do is know how to Google. In fact, recently published um, peer-reviewed level uh, articles are out there, and these articles came from people performing tests and studies. So these people have definitely done their homework, the few studies that are out there, and they have found the significant gaps in amputee care, the lack of peer visitors, the lack of putting amputees in touch with someone who's going to help them deal with the psychological and mental and emotional trauma that they're going to be going through way before they even go to the surgery. In fact, I find myself sometimes meeting some patients who they're basically a partial foot amputee, diabetic. Things are not going so well. Infection still is creeping in the blood system and in the bone. I talk with them and we have that tough discussion about where this could end up, where this could go. And in that process of talking with them and covering this, most of them look at you like, why are you doing this? Why are you having this talk with me? And I tell them why, because of what I've seen in the last 6 years of me doing this job, what I see. And the other day I was with a gentleman and we had this discussion, and right at the end, when I said to him, do you know why I'm having this talk with you? He says, no, because I don't. He says, this is somewhere where I wasn't wanting or expecting to go today. And I said, but you need to really be able to talk about this, because if it goes that route and an infection gets into your bone, it moves fast. So you have to make a decision. You need to have the information to be able to make that decision and make it fast and make it right, and know that there's going to be an outcome out there that's going to be positive for you. So I lifted up my pants leg, and the look on his face, his eyes he was like in a trance, just staring at my leg, and saw my prosthesis, and he started tearing up. And he says, this is something that I didn't want to think about, but seeing you, I had no clue you were an amputee, makes me feel a sigh of relief. And that's what it's all about, being a peer visitor, being an amputee peer support visitor. I consider myself a peer counselor. Um, Trust me, the need for psychological support is there. Very therapeutic, education wise, information wise. Um, there is a huge need for it. The patient education after amputation uh, aspect of being a peer visitor and peer counseling and amputee peer support, it is something that is not found as much as we should be finding it in the areas where we should be seeing it. I can tell that from just the posts that I put on Facebook, some of your responses. Some of you never got in touch with anybody. Some of you didn't get in touch with somebody until well after your amputation and after you'd already been through so much. So it's really important to make sure that we talk about this topic, you know about this topic, so you can educate the people who are working with you, your orthopedic surgeons, your rehab team. Everyone should know about this, and everyone should be trying to incorporate something like this into um, their practice, their facility, their rehab, because it is so important. Some of these studies that I pulled some of my notes from basically showed that there is such a lack of the patient education after amputation. And this was done from a systematic review with experts and their opinions. An additional study that reinforced the desire to address the psychological healing of amputees found that patients felt abandoned during the surgical phase of the amputation process, describing it as a feeling of being in a vacuum. Well, tonight, my friends, let's take a look at amputee peer support, why it is so important, why it should be a part of normal prosthetic care, normal orthopedic surgeons amputation protocol, post-op, pre-op, and post-op, why this is so important. So when we come back, we're going to take a look at why this is so crucial to so many of us. And as we come back from that wonderful little tune there that makes you kick your feet a little bit, we would like to thank uh, our sponsors who help us with this show. And I always want to try and give them proper recognition. Today, for this beginning of the show in segment one, I want to thank Valley Wound Healing Center in Modesto, California. They are a great place to go if you need wound care. In fact, they're going to be out with us at our event here in Modesto, California at Modesto Junior College at the West Campus. For those of you that live out here, you know where that's at. We're doing an event this weekend on Saturday from 10 to 4. It is a community health and wellness fair that I came up with and put together to try and help everyone out in this area know about your local resources and get some information and education on the facilities, the doctors, and the people that you have around you that could possibly help you avoid losing a limb. And that's what the whole health fair is all about, sponsored by my company, Synergy Prosthetics, and so many others, Valley Wound Healing Center, Central Valley Specialty Hospital. Man, there's so many people, Emmanuel Rehabilitation, Turlock Nursing and Rehabilitation. There's so many people that are coming out, and it's going to be hot. It's going to be 100 degrees, I think. We've got Rita's. They're going to be bringing out their truck and providing some nice, cool refreshments out there. We also have music, and from what I hear, there might be some fancy cars that show up and sit in the parking lot that you guys might want to go check out. But I definitely want to thank Valley Wound Healing Center for sponsoring this segment of the show. Let's get back into this. Peer support. Well, first off, how did peer support come about? Where are the origins? Where did it come from? When did it start? All these questions are very important for us to really understand the peer support concept. A brief history of peer support and its origins. Losing a limb is a challenging event It is a life-changing event. How much life depends on variables that make the challenges that we face each person. We will face those unique difficulties and challenges in our life uh, when we go through something such as amputation. It is a life changing, challenging experience, event in our life. An amputation might be just a blip on the screen of life for some people, but for others, it can be very devastating. It can bring your life to a complete stop. It can put you in a very dark place. It may be like stepping into another world where even the most ordinary activities of daily life have to be rethought. You got to relearn stuff. The person undergoing the amputation is likely not alone in his or her transition, but finding those other people to help you along the way, that's the hard part sometimes. Not only is it not only is this person, he or she, affected and going to be affected, but some of their family members, people that are connected to this person, to some extent, so is everyone connected with that person. They will be affected by the amputation, including their spouse, partner, children, family members, friends, employers, co-workers. Amputation is a devastating, life-changing event, not just for you, the amputee, but for everyone that is connected to you. If you're a recent amputee, you're entering into a new place of life with a lot of unknowns. You're going to have to learn a lot of new habits. You're going to have to retrain your mind, your body. The uncertainty of the future can definitely create a wide range of emotions: stress, anxiety, depression, anger, as well as a countless amount of questions. I think that's the biggest thing that I experience when I do visits. Questions. I always start out with, what are your questions? It can be hard to imagine what the future will be like without a limb, whether it's an arm or leg or hand. Now, the contemporary era of organized peer support, all of us, we owe this to, and our success of peer support and peer visiting, we owe our success to a small part uh, to the mental health consumer movement. This started way back in 1970. The social movement empowered former mental health service users to help each other, uh, to advocate for themselves. From this humble beginning, from these roots, peer support quickly found new applications in chronic disease, um, managing that, diabetes, mental health, heart disease, cancer, asthma, HIV, AIDS, substance abuse, screening and prevention of infectious diseases, hepatitis, and it even got into the maternal aspect of things: child health, uh, mother health, breastfeeding, nutrition, postpartum depression. Yes, they have support groups for those. They have support people that go out and deal with this and help those that are going through this. They have support people for that. This is the early history, the origins of peer support. As the psychology or the physiology or how can we say, the concept of peer support slipped into this mainstream public interest in reaching um, all these groups of people, it now is reaching an all-time high. You see it on TV, all the cancer awareness, diabetes, peer support is everywhere. But I've yet to see an amputee peer support commercial. I would love to see that on TV. I gotta strive to be the first guy to do that. So when we're looking at this, peer support is gaining a lot of recognition in almost every sector of the health and healthcare. Health researchers are continuing to build the evidence base for all the peer support for a variety of things, diseases, conditions, populations, and settings. Healthcare providers are seeing the benefits of peer support on their medical practices, particularly when it comes to patient satisfaction and patient outcomes. Now, I'm going to stop and stop the tape for a second. I see this on a daily basis with the doctors here in the Central Valley and the facilities here in the Central Valley who have chosen to work with me, my company, over other companies that don't provide this type of foundation. I see it on a daily basis as I deal with the patients that come onto my Facebook page. I'm actually a part of their life. I will always be a part of their life. I'm their support. Whenever they need me, they call me, they can send me a Facebook message. I try to help them through the various issues that they face. And now with the talk show, I'm helping some of you out there, all the way out in Kansas and North Carolina and all wherever you guys are from. The talk show, Amp Life Talk Radio, is now becoming a peer support show that is being recognized by amputees, by Amputee Coalition of America. I look to take this further. As I've mentioned before, through Blog Talk Radio, we're in 15 countries. I want more and more people to know that this type of support is out there for those that want to listen in the privacy of their own home or their car, just sit at home with a loved one. You don't have to go to a support group. Not that they're bad, but technology allows me to change the scope of peer support. And that's what I'm trying to do every day with this show. Back to the history. Now, this principle of peer support came from believe it or not, a psychiatric hospital in the late 18th century of France. Yeah, that probably blows you away. You probably didn't know that. So what happened, the governor of the hospital in Paris, he basically recognized the value of employing some of the patients who had recovered very well as hospital staff. So the chief physician at the hospital praised these peer staff people for being gentle and honest and humane. They were able to reach and help fellow patients without acts of cruelty. Because back then, you got to realize healthcare people could be very cruel, man, and it wasn't like what we have now. We don't have They didn't have HIPAA. They didn't have all these different things protecting them. So this is how it got started. This is how it all came about. The physicians found that this was working so well, so the peer staff was being praised for being gentle, being honest, being humane, disposing all this kindness, trying to help someone else who they see was where they were at. And it turns out that hiring their former patients to make a shift in the philosophy of mental health, that changed things. It made a more moral treatment. That era became an era of change for them when they implemented this type of protocol. Peer support services are delivered by individuals who have a common life experience with the people they are trying to help or service. Servicing being the key word. As I am studying more to be a counselor on my end, taking my role as a peer visitor even further to help people. I am learning more of the techniques and the different um, concepts of counseling to add it with what I've learned from my certification with Amputee Coalition of America. People who have undergone an amputation coming out the other side, well adjusted to the loss, they have a very unique capacity to help others based on their shared affiliation, their shared affliction, their shared experiences, the deep understanding of that experience of limb loss, being able to walk into a room and connect with someone and know exactly where they're at. There is no other there is no other thing like that. And why we do not incorporate this into the pre-op and the post-op care of amputated patients, I have no clue. I am very thankful for the surgeons who allow me to do what I do, from attending surgeries, being there involved with patients who are getting revisions. It's an awesome experience. And the patients, I find, are very more prepared. In fact, I just had a patient. I got to see if she's on here tonight. My girl, Glenda. Um, I hope she is listening tonight. I don't know if she's got out of the hospital yet, but she's one of those patients that I've got to work with and was able to say um, hi to, introduce myself to, and be a part of her pre-amputation team to help her prepare herself for her surgery. And I saw her and she came out of surgery. And you know what? She was a little bit more prepared for what came to her after surgery. The tears, the shock, being able to talk to someone to tell you exactly what to expect, I think it helped her a lot. It helped her so much. So I firmly am a big believer in this peer support. The history of peer support, peer visitors, goes way back, as we can see, to the 1700s. And who would have thought it started at a psychiatric hospital? Sharing that unique capacity to help others is very unique. As I said before we got the show started, I'm a firm believer in certified peer visitors. Certified peer visitors can offer self-help and mutual support, strength, and hope to their peers, which allows for personal growth, wellness, promotion, and recovery. Certified peer visitors. I firmly believe in being a certified peer visitor. You do learn some of the listening skills that are very important to have if you're going to be doing this. And part of the reason I say that is because I know of people in my area that are just putting amputees in front of patients and not really thinking about the ramifications of what happens if this person misses something. One of the things that they teach you um, in our certification is that you need to look for triggers. People that are depressed, people that want to hurt themselves, people that are struggling, PTSD. You now need to be able to find those people resources. So if you really don't know what you're doing, you can actually do more harm than good. So very important that you have some type of training before you try to do a peer visit. It is not something that I would recommend to anyone. Hello, Clarence. How are you, man? I can actually see you guys talking to me tonight, so I will I will say hello here and there. And Eric, thanks for all the stuff for the movie. I know for some of you that have kind of heard me talking about the situation with The Rock and his movie coming out, Skyscraper. Eric has been promoting um, a amputee movie night, which is coming up this Friday. So gather up everybody, go out and check out that movie because I want to hear what everybody's thoughts are on that movie. In fact, I might be doing some interviews at my local theater, which is Riverbank. If you see me out there, I might swoop you up and get a quick statement from you about what you think about the movie. So back to our topic. I got off base there and just had to say some highs and give some props out there. So as we talk about this subject, peer support, we keep in mind certified peer visitors, so important to make sure we have proper training, proper knowledge in how to help another amputee. Now, by sharing their experiences, peers bring you're going to bring people hope in their recovery process. Uh, yes, you heard me right. Uh, and you're going to promote a sense of belonging within a community. I know I've talked to a couple of amputees, and they've told me that when they got their amputation, they didn't see another amputee, and they felt alone. They were like, "Man, am I the only guy? Am I the only person out here?" So it was one of those things to where finding another amputee and being able to connect helps so much. Uh, and I cannot stress to you the right kind of peer support can increase an amputee's sense of hope, control, ability to affect change in their lives, self-care, sense of community and belonging, satisfaction. And I think as well as it's going to help them decrease some of their levels of depression. So peer support is a very, very important thing. As we can see from the history of it, the research has shown that peer support facilitates recovery and reduces healthcare costs. That's the biggest thing, because if you got somebody helping you, you're going to be learning how you're going to have somebody kind of like keeping you in line, making sure you take care of your diabetes, making sure you're checking your limb, making sure you know when it's time to put on socks, why to put on socks. Peer support is very, very important. It's part of what I do in my daily job on a daily basis, checking on my patients, making sure that they're doing what they need to do so that they can keep themselves moving. That is the most important part of anything, is to make sure everybody is up, moving, and living their life. Peers and peer support people, we are also going to provide that assistance. And what do we want to do? We want to help them. We want to help them by promoting education. We want to help them be safe. The biggest thing I find with amputees, we want to make sure we're helping them set some goals. I find that I know for one of my patients, Tamara, she had a board with pictures on it. And these pictures were her goals: to be able to jog, to be able to work in her garden. She had pictures of other amputees doing things. And I think that was a huge uh, influence to her to get her up, get her motivated. I encourage anyone to do that. Take a picture of your kids, your grandbabies, your wife, your girlfriend, your motorcycle, whatever it is that you want to get back to. Use that as some type of motivation. It might be you want to go play hockey. You might want to be crazy like me and go run some Spartan races with Dave. But whatever it is, you got to find something that is going to be a goal for you. Okay. We can't just sit still. We got to set goals for ourselves. So peer support is very good for that. Now, another critical component that peer support provides is the development of self-efficiency. What does that mean? We need to help other amputees, especially new amputees, learn how to be self-efficient. How do you do that? Through role modeling and assisting peers to with ongoing recovery through the mastery of certain things, experiences, uh, how to put on your liners, how to clean them, how to take care of them. Um, we have an interview with um, the No-Handed Bandit. It's going to be our next show. And we talked about some of this peer support and how it was for him when he lost his hands, what was out there for him, where he found support at, who he talked to. And you'll be very surprised to hear what he says, but um, be ready for his interviews coming up. Our next show next Wednesday, I'm going to have him on the show, and we did a wonderful interview. And if you haven't checked him out, go check him out. So there are so many important things that peer support and peer visitors can do for new amputees. Now, here's a fact. The largest and longest continuous running peer support program is what? And it was founded in 1935 as a hospital-based program in Akron, Ohio. Man, I should make that a question and give away a coffee mug, huh? See who can get that. Well, I'm going to give it to you because you get a coffee mug by how? Sharing the show. When I have a live show, you need to share the show. I got my best friend trying to call me on the phone over there, and I was bugging him earlier trying to test my show, trying to test my call. So he's trying to call me back, figure out what's going on with me. So let's point that fact out again. A fact. The largest and longest continuous running peer support program is what? It was founded in 1935 as a hospital-based program in Akron, Ohio. Do you know, Eric? Do you know? Does anybody know? Clarence, do you guys know? Well, I'm going to tell you, it's AA. AA is one of the largest peer support programs that was longest and largest that was founded way back in the day. So that's a little history about some of peer support programs that started and are pretty much the origins for why we do what we do today in amputee peer support. And it's good to know these things because they're really important. Quick break, and we're going to be right back. And everybody, I just had to wet my lips there to come back from that break and had to take care of a little house cleaning inside that break. As we go into segment 2 of the show, I would like to say a very big thank you to Dr. Brayton, who is a pretty cool cat and a great surgeon. He is at OrthoMed Center here in Modesto, California. If you need any type of professional um, advice as far as what's going on with your lower extremities, we all find ourselves in that situation. I think you should go talk to him and talk to his staff there. Dr. Brayton, Dr. Purnell, Marco, all these guys are pretty awesome at what they do. And I think they're pretty awesome with working with patients and helping patients out. So if you have any questions about you might be potentially going in for some type of orthopedic surgery, go see Dr. Brayton at OrthoMed Center here in Modesto, California. Tell him Sean sent you over. I'm quite sure he'd really like that. So, segment two of the show, we want to talk about why peer amputee peer support program is important. Why is a amputee peer support program important? That's a really good question. Why do you think it's important? Uh, do you know? Uh, I mean, do you understand why peer support programs are in place? I think you should because we just covered the history behind amputee peer support. The question is do you know that there is a peer support for health, for mental health and substance abuse? There is even a peer support program in chronic disease such as diabetes, heart disease, asthma, cancer, HIV and AIDS, and other infectious diseases, and a maternal child health programs, as we covered before, that talk about helping moms with breastfeeding, nutrition, postpartum depression. But my question is this: when we talk about why a peer support for amputee is so important, why not for amputees and amputation? If we have all these other programs that are getting wonderful resources inside of hospitals. I go into hospitals and try and talk about this, and they kind of look at you like you fell off a truck and bumped your head. I saw it from the questions that I got from you guys when I posted on Facebook the question. Some of you have already tried in your local areas, and you pretty much were just blown off. Why is something so crucial and important not being taken serious by healthcare professionals? Well, I'm going to have to say, I truly believe there are, uh, how can I say, there is a lack of understanding and education about what peer visitors and support does, how it is proven to be effective. For someone to not understand that in a healthcare setting is pretty sad. And you would think that we need to get out there and educate more people and have more people understand that this is something that really needs to be looked at. And working for a prosthetic company, Synergy Prosthetics, I am so proud that we put this as part of our care. Me as a director of patient care, this is one of the number one things I do with patients is cover the peer uh, aspect of things right off the bat. And we continue to do that as we work with them. For someone, my discussion with other amputees, I think there is also an issue with finding qualified individuals. I think that's probably the hardest part. Just because you're an amputee does not mean that you're a peer visitor. I know that I'm going to catch flack for that, but I can't stress that enough. Yes, you're an amputee, but are you meant to be in a role to where you're trying to mentor and teach and educate another amputee in a in probably one of the most important moments in his life without training? Can it be done? I'm quite sure it can. Is it advisable? No. So there that is. There should be training. There is also the understanding of the commitment that you're about to take on. I heard from some of you out there that some of the peer visitors that you had contact with, they just were not committed. They didn't really want to handle your questions or follow through with you. I think that's a commitment issue. It could also be a lack of uh, understanding and knowledge to be able to help you with some of your questions. Um, or, worst case scenario, the motivation of the peer visit is profit driven. And I hate to say this, but yes, I have seen that in my time here with my company, where certain companies are basically using other amputees to try and get a prosthetic patient rather than truly try to care for the patient. Yes, I'm going to put that out there. Um, I would not say it if I have not seen it with my own eyes. And I think we need to make sure that we pay attention to this and bring attention to it as amputees, because peer visiting and peer visitors are so important. We don't want to have someone go into a hospital or facility, leave a bad taste. So then here comes you along trying to do something right and good, but because they had a bad experience with it, you're going to get the door slammed in your face. So I'm talking about it because it has happened. It does happen. And we need to make sure that we bring attention to it, because I'm an advocate for patients' rights, especially amputees. And I'm going to stand up and say this stuff that most people won't say. But you know what? I'm going to bring it. I'm going to bring it to the front, man. I'm going to put it out there. Like it or not, that's why my logo is a hot mic, because I'm going to bring that fire, baby. So this is what the show is about. And these are serious issues. And we need to make sure that we are um, addressing these issues, because this is something that is so crucial to new amputees. And as you're going to see later on in the show, at the rate of amputations that are happening here and all over the world, we need this. We need this badly. Now, what is a amputee peer visit? That's probably a really good question. What do you think an amputee peer visit consists of? If you had to do one, how would you do it? How would you go about it? How would you pull that off? You're walking through the hospital, they're telling you about the patient, and you've got, let's say, you've got a trauma victim who was gunshot, gang related. What are you going to do? Family's there. What are you going to do when you walk into that room? What's the first word you're going to say? What is a amputee peer visit? How do you go about that? How do you even deal with it? How do you process that through your head? How do you go in there and deal with it? Well, when coping with a life altering event like an amputation, your best bet is to talk to someone who is a certified amputee peer visitor. I am proud to say that soon my title will be certified amputee peer counselor. And there's a long story behind that. Try looking it up, you won't find it. But I got some stuff that I'm working on. What is an amputee peer visit? I think it's not so much as what it is who's going to do it and how you're going to address what needs to be addressed. Typically, you want someone with a similar history who can offer you extremely valuable insight into the rehabilitation process, the limb loss process, the emotional process. But I think all amputees are somewhat connected, whether it's an arm, hand, leg, above the knee, below the knee. We all have a connection. And I think we all can relate to each other. By speaking to another person who shares your experiences, you can begin to unravel some of the emotional wreckage, the emotional feelings and fear and doubt, worries, confusion. And you can start to begin to imagine a new life that's productive and enjoyable just by seeing an amputee walk into your room. I know what I do on a daily basis when I walk in and they don't know I'm an amputee. And then when they find out, all the above happens. To help an amputee navigate their new life, their new experiences, their new emotions, some of the hospitals I work with, I arrange peer visits, and people call me all the time for them. The peer visitor will be a source of information. When I come to a peer visit, when I know I'm being called for a peer visit, I try to get as much information as I can from my social worker, my caseworker, the doctor, the surgeon, the nurses. I do a lot of stops before I actually talk to the patient because I want to have that information before I walk into that room. So I know how to talk about the information I need to relay to him or her. I need to know the guidance that I'm going to need to lay down for this patient. What type of emotional support? Where is this person at? Even to be able to start to help them to navigate this ocean of emotions that they're feeling, to answer some of their questions, to help them with some of the decisions that are going to be coming their way. The choices and the alternatives you'll face as a peer visitor going into this situation, you never know. So when you say, what is a peer visit? What is it like? It is something that you never know because they're all different. Being a peer visitor, you need to know your stuff. It's that simple. You need to know your stuff. Peer visits are useful before and just after the amputation. I've met people at all different stages, and I find that you're able to help people if you take some time to really get to know them and hear their story. But sometimes it may go for months before they actually get to talk to you. And I think the peer visitor can be a role model and help people have a successful recovery. Sometimes you're just going to be that person that finally answers a lot of questions that they have had that nobody ever really did. The person probably never even had a peer visit or even know what that's about. So a lot of times you're going to be that first person that they get real information from. Keep in mind, when we talk about peer support, peer visits, it can be in a group or it can be in a one-on-one setting. Peer support is something that is handy no matter how you do the peer support. If you're doing peer support in a group setting, you will have some other variables to deal with because you have other people. You may have all types of things when you go into a group setting. A peer support program and the peer visitor go beyond the medical intervention. It's emotional intervention and empowerment. And it's a great resource for both those new to the amputee community and those experienced amputees who want to share their knowledge and experience. So the support group can be a great aspect and tool in this peer support system that we're talking about. Now let's get into the modern age. Amputee support groups online. I would say to you, if that's where you're going, be very careful. Make sure you do your homework. You pay attention to what you're about to get yourself into, because I think some people can be very mean in some groups, and you can get a lot of misinformation if you're not careful. If you want to keep yourself on solid ground, I would highly suggest you go to Amputee Coalition of America, ACA. Check it out. Try and find a certified peer visitor in your area by looking at their map. If you're in the Central Valley area, you're probably going to get me, buddy. But if you go to www.amputeecoalitionofamerica.org, I think they have like a dash in there. Just punch it in, Amputee Coalition of America, in Google, Bing, whatever your search bar is. You're going to find a lot of resources, a lot of information. And if you really want a peer visit, just go in there and fill out the form and let them know some details about yourself. Somebody asked me the other day why they asked all these questions. It's because the person who's going to be looking at that, trying to help you, you're giving him some information to try and help you. So when they're asking you to fill these things out, when I get those, I'm looking at that and I'm reading through that, trying to see, okay, I'm trying to get as much information as I can before I either one, visit you, or two, call you. So when you go in there and you fill out the form at Amputee Coalition of America for a peer visit, please, please put as much information as possible, because it's going to make it easier for your peer visitor to be able to do what he needs to do when he calls you or contacts you. Segment 3, we're getting ready to close out our show and wrap this thing up. I titled it, Houston, We Have a Problem. And here's why I titled it that. Limb loss in the United States is a growing and infrequent healthcare problem, due in part to the increasing incidence of amputation caused by diabetes and other vascular disease. I told you earlier in the show, we're going to get to some numbers and why peer visitors and amputee peer support is so crucial and important to be part of the pre-op and post-op protocol in every hospital. It should be, hands down, no questions. So when we look at this, we have a problem on our hands with amputations worldwide. As a result, healthcare costs continue to be a concern, and a portion of the burden of those costs are associated with what? Psychological comorbidities, common among the amputee population. Bingo. Why amputee peer visitors and peer support is so important. In the United States, there are approximately 2 million people living with limb loss and an estimated 185 amputations occurring annually. These are old numbers. Most of you have heard these numbers from Amputee Coalition of America, and everybody seems to quote them in all of their studies. I'm telling you, amputations, by the time we hit 2050, they are looking at 3.6 million people by then. Approximately 82% of major amputations in the United States are the result of a vascular disease, 16% trauma, 1% cancer, and another 1% congenital. Secondary conditions such as pain and depression are very common among recent amputees and may linger far longer than previously expected. Okay, then we get into phantom pain, residual limb pain, back pain, all these things that are going on with an amputee, that they are just being blown away by all this stuff, and they need help. They need somebody to walk them through this deep, dark moment in their life. Depression is one of the most, how can we say, 35% inpatient amputees are going to experience this. How do we do it? How do we help them reduce depression and anxiety and improve their quality of life, especially in these patients with disease and chronic conditions, other than limb loss? Peer support. Peer support is, you saw it earlier. They have all these peer support groups for all these different groups of people. Why not a one-on-one peer support or peer support group type setting for amputees? It needs to happen. It will provide the assistance so that people can be more successful at recovering from a traumatic amputation or a serious amputation. There has been much published regarding the intervention to improve the physical rehabilitation of amputees post-operatively. However, there is a limited amount of evidence on the preparing patients psychologically for the life after limb loss. The value of peer support has been well documented in several other disciplines, including, as we saw, breast cancer, mental health, substance abuse. All these different things, or these groups, have had some type of peer support that has proven to be very, very successful. Peer support for amputees continues to gain widespread acceptance. And hopefully, I will spread that word even more with this show. In spite of the fact that evidence is lacking, we need more out there. The aim of this uh, integrated review that most of these studies have done and examined the bodies of evidence that talk about amputee peer support, and they have developed reasonable clinical uh, recommendations for pre-op and post-op involvement from amputee peer visitors, amputee peer support. The value of peer support in many medical disciplines uh, has been well studied and demonstrated to improve the outcome of those patients, most notably in the mental health and substance abuse area. So, conclusively, evidence exists proving that psychological aspects of amputee rehabilitation is unmet. It is an unmet need. Therefore, the potential to change this with peer support for amputees is so important for us to spread this word, spread this knowledge to those in the healthcare industry to make sure that amputees are getting proper care. Now, as I move into our last segment of the show, which is segment 4, why should you be a certified peer visitor? Well, I kind of mentioned a lot of that stuff in the beginning. You're going to get a lot of training. You're going to get a lot of valuable tools that are going to help you if you decide to go and do this with Amputee Coalition of America or some other organization and take this to the next level. It's really, really valuable, and you're going to learn some really cool things. Peer support is going to be something that's going to occur when you are providing that knowledge and experience and emotional, social, and practical help to an amputee. It's going to be great. You're going to be a part of something that will be lasting in someone's life forever. I still have a kid to this day. Hello, Glenda. That hopefully he listens to the show sometimes. I met him when I first started doing peer support for Amputee Coalition of America. Hey, Matt, what's going on? I'm glad you made it. So, yes, I can see you guys now, and I can respond a little bit to everybody as they pop into the show. We're about to wrap up, guys. So hopefully you guys will listen to this show a little bit later and check out everything that we talked about. As we're closing out the show, I wanted to make sure I talked about some of the important aspects of why peer support and being a certified peer visitor is so important. Peer support is very distinct from other forms of social support in the source of support is a peer, a person who is familiar with what you have been through. They have real life experience on what you're going through. A peer is a person or someone that's going to be in a position to offer support by virtue and relevance of experience or relevant experience. They have been there, done that, and they can definitely relate to others who are now in a similar situation. So speaking to another amputee can help you understand the pathways that lies ahead of you. Peer support definitely links you with individuals, information, resources that will definitely be able to help your family members. A program, as far as a peer support program, they're also important too, because some people just need to get out and be around other amputees. And I know that that's very, very important. So if you find that you are in this group and you need this type of help, my advice to you is get out there and look because you're going to find that peer support is something that is so important and crucial to each and every amputee that is looking for it. Speaking with another amputee can play an important role in your preparation, recovery, and rehabilitation from limb loss. In fact, speaking to someone who personally understands what it means to lose a limb can offer a great deal of relief to an amputee. You can ask them questions. You can discuss all the issues that you feel you can't talk with anybody else. Um, Especially you're dealing with someone who has been there, done that. A true amputee support program should enable individuals to connect with trained amputee volunteers who will and who are willing to share their knowledge, experience to assist them during their transition to recovery. So hopefully some of this has given you guys a little bit of insight on why peer support. We all hear this peer support thing and peer visitors and peer this and peer that. Why is it important? Well, this is why it's important and what we need to fight for. If you are out there and you are going to be going through an amputation, you need to ask those questions. Do they have this pre-op type of service so that you can get a better understanding and find that support before your surgery? Because it's going to help you when you come out the other end. I kid you not. I see it in all the patients that I work with. And trust me, I have quite a few here in the Central Valley area. And a lot of my patients are on my page here in Facebook. Feel free to go through and talk to any of them and ask them questions about the experience and what it's like to have someone come and speak with them and spend time with them even before the amputation, what it helps them do. So the perceived loss of ability to engage in your vocational, social, sexual, and leisure activities, these things can play a major role in post-amputation quality of life. The amputation can be a negative influence on your body image, self-esteem. It is so important to get connected with someone early on so that you can deal with these issues and get some of the questions answered and find that support for your physical and psychological, psychosocial needs. Amputee peer visits do make a difference. Okay. So as we wrap up the show here, I want to thank everybody for tuning in to listen to another show. One of the main things people are unprepared for, I think, is the reality of recovery and healing time. Uh, when I do a pre-amputation or post-amputation counseling session with someone, I always tell the patients they're going to need a lot of patience, and that's going to need to be their middle name. And when you kind of bring that up in that setting and that situation, what you kind of find is that it kind of lightens the mood a little bit because, you know, there's always somebody there that will tell him he's not the most patient person. So, but truly, you will need a lot of patience. I tell patients all the time, um, you'll find your new norm. You'll find your new habits. You'll develop new habits. And it's just a new way of learning how to do things. But over time, things will get better and easier. And you may know that by doing certain things a certain way all the time, it's going to become repetitive. It's going to become second nature. And before you know it, you're going to be doing it without even thinking about it. I want to thank all of you for tuning in to another episode of Amp Life Talk Radio. Cannot thank you enough. Everybody, man, I much appreciate it. Before I get out of here, if you are in the Central Valley area, Tracy, Livermore, Merced, Atwater, if you're in California, NorCal, in my territory, Stanislaus, Central Valley, Merced. Saturday, I have an event that my company is putting on, Synergy Prosthetics, with a bunch of other healthcare people. We're providing information, some free services, testing. Please come out. Modesto Junior College, the West Campus off Blue Gum Road. Please get there. It's from 10 until 4. Yes, it's going to be hot. I already looked at the weather. It's going to be about 100 degrees. But hey, man, we're going to help take your mind off of that because we have a band and music that's going to be playing all day. I think there's going to be some fancy cars showing up. And we have Rita's. They're going to be stopping by. If you guys know about Rita's, you know that they have the cool on a hot day. And they're going to have the truck there. And I want you guys to be able to pull in, get something cool, walk around. You're going to get a health report card from us. Get that card filled out. Take it home with you. It's kind of like your performance, your health grade. You can take that and hopefully you'll learn something from it, get some information on that card to where you can go and be a little bit more proactive and preventative in your care. It's all about preventing limb loss. You'll also see myself and Dave, the one-legged Spartan. We're going to be out there doing some different things at our booth, the Synergy booth. A lot of people are going to be there. I hope that all of you will come out and enjoy it with us, and just take the time to bring the kids by. In fact, I think there's some type of raffle that my lady's putting together with a bunch of stuff for females, little kids. I think there's some makeup, there's ribbons, there's all kinds of stuff in there that she's trying to do to help you guys enjoy your time on that Saturday when you come out and spend it with us. I'm going to have my camera taking pictures of all you, and we're going to put it up on the Facebook page for the event. Remember, it's the Community Health and Wellness Fair 2018, sponsored by Synergy Prosthetics, Valley Wound Care, Central Valley, Emmanuel Rehab, Turlock Rehab. There's so many people, Athletic and Industrial. There's so many people on this ticket that are out there. Hey, we got a guy, I think he's RC Nutrition. Got to come out there, check this guy out. He's going to be putting together some nutrition plans for you diabetic people that will help you understand how to eat more healthier and keep your diabetes under control. There's a lot of stuff that's going to be out there. Make sure you get out there. Make sure you stop by. Check us out. Again, I cannot thank you enough. Oh, and Friday, get your butts out to the movies. Skyscraper, Eric is putting on a National Amputee Movie Night. Get out there, check out The Rock. He's playing an amputee. I'd like to get a bunch of your thoughts from it. I'm going to be interviewing people at the Riverbank Theater. I'm going to get a couple interviews because that's where I'm going to go watch the movie. So I'll be looking for some of you guys out there. Make sure you come up and say hi. Again, sharing the show, get you a coffee mug. I got a couple of you guys that I'm waiting for the containers to ship these out to come in, and you're going to be getting your coffee mugs. Do me a favor, take a picture with it and send it over to me on Facebook. Now, I like to hope all of you had a wonderful time here. You enjoyed your stay. Hey, spread the word. We're on iTunes, iHeartRadio. We actually have our own app, Amp Life Talk Radio app, on Google Play Store. Man, there's so much to say at the end of a show. I appreciate all your feedback. Leave me your comments. If you have questions or if you want to just talk to someone with regards to peer counseling, peer visitor, I am always at your disposal on Facebook. Drop me a message and I will definitely get back in touch with you. As you can ask anybody on my page. I have responded to several people, and I always try and give you an ear to listen, and I always try to offer up the best advice that I can for your particular situation. Again, thanks everybody for tuning in. Thanks everybody for listening to another episode of Amp Life Talk Radio.
You are listening to Sean Harrison on Amp Life Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.
Okay, all you Facebook peeps, thanks again for tuning in, checking out the show. I want to thank all of you for being here and listening. I really appreciate it. Hey, that was hopefully a good show for some of you that um, basically needed some information on peer support, why it's important, and how to spread that knowledge to some of the doctors and facilities and healthcare people. Just have them listen to the show, man, and they'll learn something about why this is so important. So, those of you on Facebook, you get to see my office. It's a wreck, man. Hopefully, by the next show, I'll have this a little bit looking a little bit better for you guys. Hey, I want to thank all you guys for tuning in, listening to the show. I'm looking back up through some of my comments to see if I missed anything. Matt, Glenda, Eric, all you guys, thanks for listening to the show, tuning in, checking me out. And I can't say thanks enough. So, Miss Glenda, I'll be seeing you soon, young lady. And everybody have a wonderful evening. And like I said, if you are here in the Central Valley area, make sure you make it out to Modesto Junior College, the West Campus on Blue Gum Road on Saturday. We have a community health and wellness fair, and we got a lot of cool things going on. And I'd like to see you guys out there. Okay. Everybody take care. Peace.